after you, I guess, exited ClinicUp or closed it down because of the various troubles you had with it, you ended up working to some degree with MDisrupt as well as Enlightened. Both these groups allow specifically for startups to connect with clinicians or experts in a field to allow for, I guess, vetting of a health specific, claim that that a startup may have. So in your perspective or in your words, would you agree or disagree with the value add that I had just voiced? Or was there any value add from a physician's perspective that these different groups have as well?
No, I would say it's kind of my quick answer.
Okay.
There's a lot of physicians looking to leave clinical medicine.
Mm-hmm.
Consulting for startups is not a viable path.
Why?
Startups don't have the money, and most of them do not do well. The startups that will succeed, they're invested by VCs, or even the ones we invest in. We give them free advice because we have money in them. And, $500 here and there, that's not a viable path.
Fair.
What I would recommend physicians who want to get into investing or into the startup ecosystem, give your advice for free, but limit it to like an hour every other week or an hour a month. Something that's reasonable. Don't give too much advice for free. You can take equity. You can charge for it, especially if you're in a very niche specialty. You're the only one that does, I don't know, interventional mitral valve replacements or something very esoteric, very specific. Then yeah, you can charge for your expertise. But the market there is more established companies, pharmaceutical companies, medical device companies, Roche, and, big pharma. They will pay hour for your advice. It's not startups. So because A, they don't have money, and B, the advice they're looking for is somewhat different. Usually when pharma or these more established companies, they're looking for advice that is more immediate, actionable. So maybe they have a product already and they're looking for a commercialization, go-to-market strategy, or they just want to get your opinion on it. A startup doesn't have a product usually. And depending, again, there's a lot of variance here between software startup versus a medical device versus diagnostic versus biotech. But I think it's a great way to be involved, but it's not, I think it's hard to build a viable business physician perspective. Startups need physicians to be involved. I think that's very important that we are. But conferences, part of different angel groups, or even just posting on LinkedIn. The way I did it, so I formally advised one startup for equity. And it was, the way they found me is through a group called SOAP, Society of Physician Entrepreneurs. So you can join these groups and you can just post your thoughts on LinkedIn. Just, So our workflow and the deficiencies in our workflow and our pain points are very obvious to us. Missed appointments, or the fact that I see 70 there, or the fact that these things could be automated, liability billing, but they're not obvious to entrepreneurs. They're not obvious to software engineers or founders. So just saying those things out on platform like LinkedIn or Twitter, I think goes a long way.
Yeah, that's fair enough.